fellow in the center here is Dr. John Moore. John was actually at the Media Lab working for a group that did non-invasive brain interfaces when I created my group, but he had been a doctor and quit the practice of medicine because he felt that he couldn't communicate and connect with his patients, that there was so much paperwork to fill out, there was so many administrative tasks and duties that he would just sit down to his computer, fill out some forms, wouldn't listen to, touch, or even understand his patient. And this gave him the passion to solve this problem. We talked. I encouraged him to transfer from his group to create the new Media Medicine group, which is a group of about 4 students at the lab. That's the group in which I direct. I'm still associated with that group as director. And the whole point of this group was to unleash the power of ordinary people to take control of their health using technology. And it really, the basic principle was that we dramatically underestimate the power of ordinary people to take control of their health, whether it's insurance companies, hospitals, managed care providers, physicians themselves. When you take the extreme idea of unleashing that capability, amazing things can happen. We created a group and we've created a number of projects, but what we discovered along the way was that there were so many different, diverse and unconnected technologies being developed in the world for consumer and mobile health. You may know of them. There are hundreds and thousands of startups now throughout the world. I mean, you look at a smartphone and you say, what can this do? And so we decided to try and leverage those by developing some core technologies that would accelerate and catalyze the rate at which this consumer health or mobile health market would take off. That was our idea. That was really John's idea and some of our students. And instead of just developing applications on smartphones and on iPads and tablets and on social media networks, at the same time, John and the students created a platform that could be used by anyone to quickly develop consumer or mobile health applications. I'm not going to go into the technology here, but it just includes a lot of the services that you would use if you wanted to create an application that used social media, that used visualization, that did big data analysis, for example, and then a bunch of plugins that anybody who wanted to develop a consumer health application could use. Common things like a medication clock, charts that chart the medication that you're taking, games, gamification is very important in consumer health to change behavior, engage people, social networking, and so forth. And all of the technology developed at the Media Lab, not just in my group and other groups, is being developed in this collaborative platform. Why? Because these applications will interoperate with one another. They'll use the same data, the same interfaces. Our idea is this could help this consumer health and mobile health market take off, just like Windows did for the PC or other middleware has done. So that's really the idea that's behind this. Now, let me just give you a quick example of some applications that were developed at the lab by John for the purpose of collaboration between doctors and their patients. Just a quick example, if we can give that up.
Hello, my name is Linda, and I work at the MIT Media Lab with the new Media Medicine group. Julie and her physician
Can we turn it up a little bit?
have successfully controlled her diabetes with diet and exercise for 5 years. Recently, they have decided that it will be beneficial for her to start a medication. Julie keeps track of her medication through a number of synchronized devices. Collaborative helps her and John contact each other anytime, anywhere. This positive reinforcement helps Julie keep up with her regimen. Julie has been doing great for over a year, but she recently had an injury to her foot. Hello, Julie.
Hello, Linda.
What can I do to help you today?
I've had a sore in my foot for a while now. It's painful and it isn't healing.
I am sorry to hear about that. Can you show it to me? I send the new information to John, helping him care for Julie more efficiently and effectively. A message is delivered to his screen, requesting his attention regarding Julie's case when he is free. John reviews the data from my interaction with Julie and her personal history. He concludes that her rising blood sugars are a consequence of wound infection. John's notification is queued on Julie's message system, reaching her almost immediately.
Hi Julie, I scheduled you for an appointment at 5 p.m. today. The sick room that's infected, and I want to take a closer look at it.
Okay, well this just gives you an example. This was just a quick video that we made to illustrate the power of the kinds of applications that can be developed. But these were all developed in this collaborative platform. So the medication reminders, the avatar, which is backed up by artificial intelligence and common sense computing, a very rich wealth, I'm told there's 10 minutes, okay, of technology was used to do this. So let me move forward quickly now and tell you about this hackathon. First of all, we brought together people from around the country and even around the world, both companies who are interested in consumer health, pharmaceutical companies, consumer product and consumer electronic companies, and we put them in the 6th floor of the Media Lab. Spark Capital, one of the venture capitalists in the Boston area, was kind enough to provide us with a $10,000 prize to get people attracted and to award them for the best project, although that wasn't the purpose. And let me just give you an idea of how this went. We got about 50 people, very diverse. Again, these weren't Media Lab students, they were just people that were interested in this. We spent the day touring the lab, seeing the other projects, and then giving them a primer on collaborative. We then divided them up into 10 groups, according to their interest, and said, you have access to all the workshops in the lab. It was during, excuse me, the independent period at the Media Lab, so the students weren't using all this. Go build 6 of these applications and see what happens. And let me just give you a feel for the applications that were developed in this very short period of time. The first was diabetes management, and as you probably know, the problem of individuals managing their diabetes is important because the rate at which diabetes is growing is huge. People have to manage their medications, their exercise, their diet. It turns out that only about 20% of people do this accurately. So how can you change that? And this group took a bunch of different technologies and integrated them together very quickly to try and give a tool for measuring diet, exercise, and medication, communicating that between patient and doctor, and then creating a metaphor for young people, actually in most cases, to manage their blood glucose level by keeping it between the clouds and the mountains here. It was a simple game, but we were able to test that on a few people who had diabetes. And I'll just give you a quick show of some of the technologies that were developed very quickly using Collaborative. One of the basic capabilities is to take pictures of food and go to a database. An insulin pen that actually was digital, and a Moto Active exercise device. And then you see here the user interface, which actually collected all that information from exercise, the food that you eat, the insulin doses that you're taking, communicated that between doctor and patient, and they ran a quick pilot with one doctor in Boston and the patient loved that. This is a particular young man who's using it here. So there was a quick application for diabetes management. Second question was pain management. About 50% of admissions to hospitals, the doctors today are around pain. A group tried to understand whether or not skin conductance, electrodermal conductance using a wristband, could actually be used as a monitor to actually enable people to keep control of their, to take measurements of their pain, keep records of it, and then transmit that to a doctor. So I'm not going to go into great detail here because I want to go quickly, but there's a wristband that does skin conductance, converts that into pain measurements. The patient can input into a smartphone where the pain is. Automatically, the level will be conveyed to the doctor through the wristband. The doctor will then be able to interact with the patient by knowing where the pain is, how much medication they've taken using a pill here. That was the pain management project. Let me go quickly forward. A third group did a cardiac rehabilitation project. Rehabilitation after a cardiac event could do a tremendous amount to prevent readmissions to hospital, but only about 10% of people ever participate in physical activity because they're afraid of what's going to happen. And so this group tried to turn that into a game. Just very quickly, we brought in some cardiac some patients who had been through cardiac operations and saw if they would be willing to test this out. A very game person here who had not done any exercise or done any of her rehabilitation exercise. And we turned this into a game. I've only shown a very small portion of it here to get you to get basically your heartbeat and your blood oxygenation level up, and then connected that in with social media and other cardiac patients. Let me just tell you about the winner of the group, and this will illustrate, I think, what went on here. Asthma management. Most kids who have asthma do not take their medicines unless they're sick. This causes a tremendous number of admissions to hospitals, sometimes serious consequences and sometimes death. We've got to get kids to take their asthma medication for breathers. This group came together, and you can just see without my talking about it how diverse they were. They were just given the one-day primer and told to develop an innovation for asthma management. They blackboarded it during the first day. They went down to the workshop in the Media Lab and created this device which they called Chameleon, which combines a spacer, which enables you to measure lung capacity, a spirometer, as well as a device for measuring the amount of medication that was taken. Breadboarded that, fed all that information into a game that kids could use and that could also be viewed by the doctor and the kids' parents. I'm not going to go into the details here. That's the device which was actually prototyped in about 3 days. And let me show you just a very quick video of a young man who has asthma who was brought in. At first, he used the spacer to determine the amount of medication, breathed into it to see his lung capacity. And basically the idea is to keep your lung capacity up at that level, and it engages kids. So they don't know anything about the amount of medicine or the frequency, or if they know about it, they try and not get too involved. We wanted to see if we put this tangibly in front of them and then connected that to the physician, what that would do in terms of engaging the kids. This project, all these projects, I didn't talk about the other two, are going to be taken forward into clinical trials or validation trials at either Boston Children's Hospital, the Mayo Clinic, Cincinnati Children's Hospital, or MGH. And so you can see what can be done with passion, with the right kind of environment in just 10 days with people who never developed these kind of things before. One of the most famous advocates, Dave DeBroncard. Anybody know E-Patient Dave? You probably follow him. A wonderful fellow, was out there for a couple of days, and he tweeted this: in this room, if what needs to get done isn't getting done, it's viewed as a system failure, not a patient compliance problem. And after he looked around, he said, these people are striving to make everything work better in our hands, meaning in patients' hands. And that is together what we have to do as a technology, as a business community, as a society. Put the power into patients' hands using these kinds of technologies. So I apologize for going through this very quickly. Maybe I can take a question or two.